Hello, my name is Jim Flood, and today I'll be talking to you about strokes, what they are, some signs and symptoms of strokes, different treatments of strokes, and an exercise prescription of someone who might have had a stroke. So I just want to start today by describing what a stroke actually is. It's known as a sudden interruption in the blood supply to part of the brain, depriving that part of the brain of oxygen and nutrients. It's known as a brain attack in some cases, and there are two types. One being hemorrhagic stroke and the other being an ischemic stroke. A hemorrhagic stroke is known or occurs when a brain aneurysm bursts or a weakened blood vessel leaks. In either of these cases, blood spills out of the vessel and into the brain or around the brain, causing pressure and swelling within the skull, damaging multiple brain cells, and that is what you can see by the image on the screen here. Hemorrhagic strokes are less common, occurring only 15% of the time of all strokes, but are more severe, resulting in 40% of deaths by stroke. The other type of stroke, as I said, is known as an ischemic stroke. This one is much more common and occurs when a blood clot in the brain results in a lack of oxygen to certain brain cells, causing them to die. Some different signs or symptoms of a stroke are paralysis or numbness of the face, arm, or leg, particularly in one side of the body. Trouble speaking or understanding speech. Someone who had a stroke may just seem completely confused for no reason. Sudden trouble seeing in one or both eyes. Trouble walking, dizziness, or loss of balance or coordination, and a sudden severe headache with no known cause. Now, symptoms from one stroke to another may be different. There have been cases where people have had completely painless strokes, so just because you are not having a headache does not mean you are not having a stroke. Symptoms of the stroke depend on the severity, which all depend on the size and the location of the blood clot or aneurysm that had burst. On the screen here we have different risk factors. On the left side you see modifiable risk factors, also known as lifestyle risk factors. They are known as hypertension, smoking, heart disease, diabetes, stress, obesity, just to name a few of them. But almost all of these risk factors can be greatly decreased by an active lifestyle. The other risk factors that we face that we cannot change are age, sex, race, and family history. I'd find that men are actually more at risk of having a stroke than women are. African Americans are more at risk than having a stroke than any other race. And with, like anything, age, the older you get, the more likely you are to have a stroke. And like age, with everything, family history is huge. If you have a big history of stroke in your family, you are already predisposed than someone who does not have any history in their family. So your treatment of a stroke is going to change depending on which stroke you had. An ischemic stroke is going to be treated more with clot-busting drug therapy, and they like to administer this within the first 4.5 hours following a stroke, because it is very key to unclot that blood vessel and return blood, oxygen, nutrients, all that to the brain cells to try and save as many as we can. An intravenous injection of tissue plasminogen activator is the clot busting drug that most doctors are going to use, and this can be administered into the arm or through an artery and directly to the site of the clot, depending on the severity of the clot. If the clot is too large, then a doctor may go in himself or herself and remove the clot with a stent. As for hemorrhagic stroke, these are more preventable treatments or management of a stroke, and they're all surgically performed. So the different types of surgical procedures that they do are known as clipping, which is when a surgeon places a clamp at the base of an aneurysm. Another one is endovascular embolization, and this is when a coil is guided into the aneurysm, which blocks blood flow and actually causes the blood to clot. Now, I know a blood clot sounds bad, and that's what causes most strokes, but in this case, if they can keep the aneurysm from bursting, then the patient has a better chance of surviving. Another one is known as surgical AVM removal, which is completely preventative. AVM is a disorder or disease, so if they're able to pick this up before it bursts, they will just go in and completely try to remove the aneurysm. And lastly, stereotactic radiosurgery seems to be relatively new, and it is the use of multiple beams of highly focused radiation to repair vesicular malformations. Very similar to the other surgical procedures, all of which are just trying to remove the aneurysm or just prevent it from bursting. So recovery is very different of a stroke from patient to patient. Again, going back to the severity of the stroke, there are some people who can completely recover from strokes, but more often than not, specifically 2/3 of the time, survivors will have some type of disability, whether that be physical or neurological. Survivors with disabilities will almost always begin a rehabilitation program of either speech therapy, physical therapy, or occupational therapy, and it is not uncommon for someone to go for all three types of therapy. But even once the rehabilitation program comes to a halt or begins to slow down, it is very important for the patient to stay active. Being active increases peak fitness up to 30% in 3 to 6 months following a stroke. It improves insulin sensitivity and glucose tolerance, and increases overall brain blood flow. So all of which are very important following a stroke. The chart I have down here at the bottom are just different benefits that really anybody, but mainly stroke victims, receive from increased activity, which, like I said, is very important in the recovery of a stroke. So here I have 4 studies that I looked into, just the titles of each one. The first one, I'm not going to read the name because it's long, but the main objective of this study was to look into the effects of aerobic training accompanied with resistance training versus just aerobic training, and the differences of how patients recovered. It was a 6-month training program, and despite being prescribed 40% less aerobic training, the aerobic training accompanied with resistance training saw similar and significant improvements in mobility and VO2 peak. This group also saw significant increases in muscular strength, endurance, and all the above, as which would be thought of to happen because the other group was not training at all as far as resistance training goes. The second study I looked into the extent to which greater enhancements in VO2 peak are possible using a treadmill protocol with far greater emphasis in intensity progression compared to a protocol without such emphasis. This was also a 6-month program, and it was found that high intensity treadmill training was far more effective than low intensity treadmill training for improving VO2 peak. The third study I looked into is pretty self-explanatory by the title. Resistive training improves insulin sensitivity after stroke. So they were just curious as to how resistance training would affect insulin sensitivity. And this ended up being the first preliminary evidence that resistance training may reduce hyperinsulinemia, and improve insulin sensitivity following a stroke. The third and final study that I looked at is different from the first three, but I found it very interesting. They looked at depression among chronic stroke victims because it is very prevalent with life-changing activities as such. So they explored whether a 10-week community-based progressive resistance training program could reduce depressive symptoms, and they found that although the numbers did not suggest that it was significant, that the group that was training in a community-based gym was significantly less depressed at the 6-month follow-up. I can speak on this a little bit as I worked with a stroke patient at a physical therapy clinic that I work at, and I could just see in the first 2 months that he was there how much his attitude has improved. Now that may go back to less anger as his disability improves, but I think it had a lot to do with just getting out and talking with people of the same age, practicing his speech, and overall just getting better. So finally here I have a case study. We have a male age 55 who is a smoker. He's got slightly high blood pressure, not bad though, not alarming. Very high total cholesterol. His father had a stroke and he has a very stressful job. He's somewhat active, only gets 60 minutes of physical activity twice a week though. So as you can see, my exercise prescription on the right here, I have him doing aerobic training for 20 to 30 minutes at 40 to 70% heart rate max 3 times a week. Resistance training 2 times a week, never on consecutive days. We keep it at 3 sets, high reps here. And then just flexibility and balance of all types to improve range of motion and overall mobility. Lastly, I just wanted to leave you with a chart here that shows things seem to be going up, or in this case, going down, as in the deaths. Research has been significant in helping people survive strokes, and I only see it getting better, which is a positive note. Lastly, here are my references, And thank you very much.